Ladies and gentlemen, welcome to one more webinar by Worthix. Today, we will be speaking about healthcare and patient experience. So today I am joined by a special guest. He is the Chief Medical Officer and Chief Operations Officer at Albert Einstein Hospital in Sao Paulo, Brazil. I'd like you to give a warm welcome to Dr. Miguel Cendoroglo. Is that how I pronounce your name?
Yes, that's right.
Dr. Cendoroglo, thank you so much for coming on today. We're really happy to have you. Just for the benefit of our listeners, can you tell them a little bit about yourself, your career, what you've excelled at, some of your accomplishments?
Oh, okay. Thanks so much for the question. I am a physician, a nephrologist by background. I graduated at the Federal University of Sao Paulo, where I did my residency, fellowship in nephrology, and master in sciences, PhD. Then I did my postdoc at Tufts University, New England Medical Center in Boston. And I continued my career to full professorship here at the Federal University of Sao Paulo. Mm-hmm. And I had a kind of a parallel career at Albert Einstein Jewish Hospital, where I was a physician at an intensivist at the ICU, and then responsible for our dialysis patients. We have a big program of chronic renal failure patients and dialysis patients. And then I moved on to the position of Chief Medical Officer, and then accumulated the position as COO. And of course, I cannot be a professor and do all these things today. So I am out of the university. I'm totally dedicated to my executive position at Albert Einstein Jewish Hospital today.
And what was that like for you? Because it is a pretty big shift. It's almost like shifting from the practical aspect of medicine into the management of medicine and physicians in hospitals. Was that a change that you welcomed, that you enjoy, or do you miss practicing medicine like firsthand?
Well, to be honest, I hope it sounds funny to many people. I thought the administrators did a very poor job, so I decided I could do better. So, but in fact, it wasn't exactly like that. I really had to pursue a career as an administrator, as a manager, and I had to go through an MBA, and I also did a course at the Advanced Management Program at Harvard Business School. So I really had to study a lot. It wasn't that simple.
Yeah, well, I'm sure you're doing great because you occupy one of the top positions. I'm not even going to say in the country, maybe even in Latin America as a whole, given that the hospital that you now currently work for is a massive reference in the healthcare industry. It's one of the leading hospitals in the continent, isn't it?
Yeah, we are very proud of that. We were the first hospital to get an accreditation by Joint Commission outside the US. Mm-hmm. So that was before even Joint Commission had a Joint Commission International branch. We also very recently one of our accomplishments was to be the only Brazilian hospital in the 50 best hospitals list from the Newsweek magazine. Wow! So we came out as number 38. Mm-hmm. I hope we do better next time. But if even ahead of some of the very good hospitals in America, so we're very proud to have achieved that. So yeah, and we also are a strategic partner with the Institute of for Healthcare Improvement in the U.S., and we have started a Latin American forum of quality and patient safety with the IHI. So we've been gathering and leading very good hospitals around Latin America. We've been doing this event every year. in a different capital of Latin America. So we did it in Mexico, we did it in Colombia. We were about to do it in Peru this year, but because of the pandemic, we transferred it to next year. Mm-hmm. And we did a number of events also in Sao Paulo, getting leaders from all over Latin America to come to Sao Paulo and exchange best practices with us. So it's been a real honor and privilege to work here. I'm very proud of our hospital.
That's awesome. Well, you know, if we could take a second to go back, let's say last year, sometime pre-pandemic, the world was already giving a lot more focus to the healthcare industry and the importance of patient experience. This was already on top of everybody's mind. I had someone share with me recently that even the famed Harvard professor, Michael Porter, has changed the focus of his studies and his research into healthcare and how to improve the system. So this is really, I would say, a chronic issue all over the globe. It's not centralized here in the US or even in Latin America. All over the world, hospitals, healthcare professionals, people who run healthcare facilities are tackling this issue of a new focus on healthcare and how to make the system better. Because in lots of cases, in lots of countries, in lots of systems, healthcare isn't doing well. And there hasn't been enough efforts in creating a better process. So what I wanted to do was, before we get into the COVID pandemic and the issues that are at hand, I wanted to take it back just a second and talk about some of your beliefs regarding patient experience, regarding healthcare. What is the responsibility of the doctors, of the managers of these hospitals, of the physicians? What are you doing as a whole to try to improve healthcare and the experience of your patients?
Well, when I did my course at Harvard Business School in 2011, we only had 2 cases. I had to study kind of 120 cases or something like that for different issues. Only 2 cases in healthcare. And one of these cases was from Cleveland Clinic, about their patient experience journey. So we had Dr. James Merlino, who today, I believe he's working at the Press-Ganey Institute in the US. He was one of the protagonists of that case, and he was there to discuss it with us. It was wonderful. And I remember some details of the case. Dr. Cosgrove, who was the CEO and a brilliant cardiovascular surgeon, one of the stories they had at Cleveland Clinic was this patient that he had operated on, and it was a very advanced procedure. Only Dr. Cosgrove was doing that kind of procedure at the time. And the father of this patient wanted to talk to him. So he thought, well, maybe it's a complication or some issue, a clinical issue with the patient. So he went there to speak with this gentleman, and he said, well, I don't think things are going well. Why? He said, why is that? The patient is well, his perfusion is good, the saturation and all that, all the clinical parameters are perfect. And, he was operated with the best surgeon in the US, and he wouldn't get that kind of care anywhere else. What was wrong? I said, well, if you can't get the floor well cleaned, it's such a simple thing you cannot take care of. How can I trust you that you're doing the best for my kid? So patient experience is something that's not exactly rational, and it's not technical. I mean, it has to do with feelings and with expectations of the patients, and we have to understand how they think. before we can expect that they can understand how we as doctors think, what's important to us. We have to ask them what's important to them. So one of the principles that that guides us here is something very simple that we learned from the leaders at the IHI, especially Nurse Bisognano, who was the CEO of the IHI for many years. And it's about making a very simple question to the patient: what matters to them? So this is what has been guiding our program for patient experience. There are many ways we can do that. You can do it as a program, as an office of patient experience in the hospital. We tried it in many ways, but more important is the values of such a program and what's behind it. So here at Albert Einstein, we decided, after hearing the staff and also hearing the patients, we started this program that's composed of 3 words, 3 letters. It's very simple, so people can really identify very rapidly with this program. It's SPA. It's S means service. It's passion to serve. It's safety. So first is safety. Second is P is passion to serve, and the third is A, which, let me see how we translate that from Portuguese to English. But it's hearing the patient's expectations. That would be the best translation. So this is taught to every person that comes to Albert Einstein since the first trainings, and we're trying to transform that into a culture. So the culture is probably the most powerful tool that we can use to convey the best patient experience. And I think, and of course, what we're trying to do here is to make everybody that works at the hospital to see themselves as caregivers, and to remember this very simple question that we have to ask the patient: what's important to them, not to us.
Yeah. Plus, it's such an emotional time for people being in a facility where they are surrounded by healing and by healers, but there's a lot of fear there as well. There's a lot of uncertainty. There's a lot of insecurity. And one of maybe the deepest fears of every human being, which is the fear of dying. And that probably takes a very strong emotional toll on the individuals, which requires a whole other level of empathy on behalf of the caregivers. And I imagine every single person that works within the hospital, from the office to the cleaning service, to the people who work in the cafes and in the food prep. I imagine that every single person within the organization has to be really aware of the fragile emotional state of the patients. Is that right?
Yes. So that's what we mean when we say that everybody is a caregiver. Even, somebody that's working in the accountant's office here, they are also caregivers, and that really makes a difference in many decisions, the day-to-day decisions. For instance, maybe there's a patient complaining about the bill and something that he doesn't understand. The attitude of the persons that are going to talk to the patient, the patient in that situation, it makes a big difference.
Yeah.
So everybody needs to see themselves as caregivers.
That's awesome. And how much do you think that prepared you guys for the pandemic that nobody was expecting? This culture, was it helpful, or when it hit, was it just everything's up in the air and let's just rush everywhere and do everything that we can at the same time? Like how was that beginning, and how long did it take for you to settle into a groove and start following processes and looking at patient experience again, and not just the matter of life and death emergencies?
So we are very focused in improving our processes all the time. So as I said, Joint Commission was in 1999, the first accreditation of our hospital. And it was we took a real hit with them because we thought we were very good at the time. And in fact, our processes were a big mess. We had to organize ourselves, and today we have big process improvement teams here. We've had more than 1,000. Today is around 2,000 concluded projects of Lean Six Sigma, improving different processes around the whole system. And one thing that was very, very important for that matter was also the focus in patient safety. So as soon as we started this partnership with the IHI in 2013, we sent one of our physicians to do this fellowship program at the IHI. During the fellowship, he visited Cincinnati Children's. Cincinnati Children's Hospital is a wonderful hospital, and it's possibly the first hospital to achieve status as a hospital of a high reliability organization. And we've been, since this fellow, Dr. Capone, came back, his project for the hospital was to make us a high reliability organization as well. So I've been pursuing it. It's not easy. It's many years to get there. These two elements, the focus in processes and in patient safety, enabled us for this moment. So we have an obsession in training, simulating situations, simulating catastrophes. We also had one of our fellows go for a post-fellowship at MIT in catastrophes. So we've been organizing ourselves for this moment for many years. We didn't know it was going to happen right now. During this crisis in early January, we were already following up what was happening in China, and we thought we might have a big crisis like this. So we started a crisis management group. We started training people, capacitating the whole system for the diagnosis, to take care of the patients for the first wave of patient care. And that's how we've managed to flatten the curve for the hospital and help the city of São Paulo to do the same. We didn't lose one patient in São Paulo or in our healthcare system due to lack of resources, lack of beds, or anything like that. And we're very proud of the mortality rates we've achieved, very low mortality rates with benchmarks and so on. And it was all possible because we've been preparing all this time for this.
That's great. And how has patient experience shifted? I imagine drastically, as with everybody else. What you thought you know about patient experiences versus the expectations that they truly created. Where was that gap, do you feel?
First, I have to tell you about our experience with the Worth Index. So we do many different surveys to assess patient experience. So after discharge surveys or during a patient admission surveys. But the most robust was this big survey that we did every year. But it was awful because it was kind of 60 or 80 questions, and the patients took almost 2 hours to fill in the survey. And we did the same with physicians. So the compliance to the survey was low, and it was unmanageable
Right.
The amount of information and to make sense of it and to make it actionable. So when we changed it to the Worth Index about 2 years ago, it was a big change for the better because it's faster, less questions, much more compliance to the survey by the patients and the physicians, and it's much more actionable than it was before. We started before the pandemic from a good knowledge about what patients think and where we should drive most of our actions to improve their patient, their experience. And the same with the physicians. So one of the things we started after understanding how the physicians what were their feelings about the hospital, we discussed the data we had with some friends at the IHI, and especially Don Berwick. So we had a big session with him, a full afternoon, and we went over the data. And we decided to start this physician compact. In fact, it was a review of the pact we have with the physicians and the new contract between them and us. Mm-hmm. And what happened was that during the pandemic, we did a new survey. So we've been doing these surveys every 6 months now. So we did a survey right in the middle of the pandemic. And it was very interesting because the first dominion that drove the results for the Worth Index before was an identification with our brand. Mm-hmm. Now, during the pandemic, it became the second dominion now stepped over, and now is the first dominion, which is quality and patient safety. And we from before this physician compact program, which is a very positive agenda with them. We had a very nice score, but it improved with by the end of last year when we started this program, and from that moment to this moment during the pandemic, it improved even better.
Wow!
So because we had a really just by looking at how the physicians are feeling and starting this program, even the top management of the organization changed. Even the other administrators changed their mindsets. Mm-hmm. So when this pandemic started, we had a very, very positive agenda with many very positive actions. For instance, patients was very, very scared to come to the hospital, and many physicians have their offices here.
Right.
So we have a number of satellite units in which, for instance, in one of those units, we do checkups. So now checkups were not being done.
Right.
So we use those offices, the very tiny offices, sure. But they're located they don't have the face of a hospital.
Sure.
And they're located more close to the patients' homes. So we've opened those spaces for these physicians to see their patients there. And the patients were not that scared to go into those units. So they started, they restarted their offices, mm-hmm. and they were very happy with that. We didn't charge them for this, so for the use of those spaces. We also provided a package for telemedicine, so they could access their patients more easily without their patients having to leave their homes. And all these things improved a lot their feelings toward the hospital. So it's been wonderful. It's been wonderful.
That's great.
As far as patients, we understood better why they were scared to come to the hospital in this very difficult moment. Mm-hmm. And we were able to provide other solutions so that they could feel safe to come to the hospital for a procedure, and they had alternatives, as I said, to get in touch with their physicians.
Through telemedicine and through satellite doctors' offices, like you said, right? Now, what do you think would be, if you had a single recommendation to other hospitals out there that are battling through the same thing, what would that suggestion be?
Well, I have a big list of suggestions. We really had to abandon all our strategic planning for this year and maybe for the next year, because we're rewriting everything, right?
Yeah.
But I think it's very important for the survival of the hospitals for the patients to come back. We know that there's a first wave in which you're worried about taking care of patients with the infection.
Yes.
There are other waves which are about patients that did not come to the hospital during an emergency.
Right.
With a myocardial infarction or a stroke or appendicitis, and they come to the hospital late already with complications. So that's a second wave of a burden of this pandemic. Mm-hmm. There's a third wave, which are the patients who did not come to the hospital for their elective procedures. It can be a severe situation like cancer. If you postpone your treatment too much, you may lose the window for cure, for instance. So apart from what happens in terms of damage to the patients, it damages the economics of the hospitals. We have broken hospitals in the US and broken hospitals in Brazil as well. Yeah. And we were very worried that we would have, for instance, maybe to lay off people because of that. So establishing a safety environment, I mean, safety in terms of real safety, patient safety, technically, but also psychological safety, right. So that patients could come back to these activities in the hospital was very important. So that would be my first and more important.
Good starting point. I gotta say.
But maybe start as soon as you can with this comeback of these activities at the hospital, because they are very important for the patients and they're very important also for the survival of the hospital and the healthcare professionals. And I think it has a lot to do with what we want to give out emotionally to the staff and the physicians. And the second, if I can give you a second suggestion, is take care of your people, because the fourth wave, I didn't talk about that, is probably more of a burden of this pandemic is mental health.
Yeah.
So I have friends. I myself have been in moments in which I was almost in burnout, and so we're very worried about that. We've established a very robust program. So we're not talking about how we're worried about the physicians, we're worried about the patients, but of all healthcare personnel here, and physicians included. So we and even patients. I think I would say the whole country here is in burnout.
Yeah. The whole world, maybe.
We have to be very careful about that. So we've established programs dedicated to that as well.
Well, that's great. Well, I can't thank you enough for coming on here and sharing your expertise. I would like to tell you that you have my respect, very deep respect for everything that you shared with us right now of what you're doing. I hope that this webinar is able to reach as many healthcare workers as possible, so that they too can at least become inspired to put some of the practices that you have been using at the Albert Einstein Hospital into work at their clinics and hospitals as well, because hopefully that'll help everybody navigate these times a little bit easier. So thank you so much. And that's, do you have some way that the people who are watching us now can maybe contact you? Do you have a LinkedIn profile that you're active on? Is there a website somewhere where they can connect with you?
I have a LinkedIn profile. I haven't been assessing it as often as I should because of all this.
I imagine.
But I have I have an email. It's Cendoroglo, my last name, at einstein.br. Okay.
It's wonderful. Great. So if you have any specific questions for Dr. Cendoroglo, go ahead and send it. Thank you so much. I appreciate you. Have a great day.
Okay, you too. Thanks so much for this opportunity.
Thank you.